Welcome to the deep dive. Today we are taking on a really complex and honestly vital topic, Ehlers Danlos Syndrome, or EDS. Yeah, this is a condition that, well, for far too long, it seems to have existed in the shadows of misdiagnosis. So our mission today is to really pull it into the light. And look, if you find this kind of knowledge valuable, if you want to keep getting information like this, please do visit Mind Expansion Daily. We'd really appreciate if you hit that like button and subscribe to Mind Expansion Daily. It genuinely helps us dedicate the serious time needed for these deep dives. And if you find our analysis truly invaluable, you can even support us by buying us a coffee. The link for that is right there in the description below. Our goal today is basically to synthesize the current understanding of EDS, this huge symptom list, the diagnostic challenges, and the real stakes involved with delayed care. And hey, once we finish up, definitely leave a comment. Let us know if you agree or disagree with our summary of the EDS symptoms. Oh, and also, to help us increase our worldwide reach, please list your location in the comments. We love to see where everyone's tuning in from. Okay, let's unpack this then. EDS. It's defined by its impact on connective tissue, which essentially means it touches pretty much every system in the body, right? It's a group of disorders, but the core problem seems to be this systemic instability.
Exactly. And what's really fascinating, I think, is understanding the mechanism underneath it all. It's basically a failure in the body's ability to produce quality collagen. Collagen is like the glue and scaffolding of the body. So when that scaffolding is faulty, because of these genetic disorders, you start seeing structural issues, well, everywhere. Globally, it's estimated about 1 in 5,000 people are affected. That translates to maybe 200,000 to 250,000 cases just in the U.S. alone.
Wow. And that structural failure, that leads directly to what our sources are calling a diagnostic nightmare. The symptoms are so diverse, sometimes even contradictory, that apparently 60% of cases get misdiagnosed, which then leads to a typical delay in treatment of, 5 to 10 years?
That's right. And that delay, it can be catastrophic.
Yeah.
Early recognition is just absolutely vital here. If you can identify this condition sooner, you can drastically mitigate future complications.
Right.
We're talking about potentially reducing the risk of joint damage by 30%.
30%.
And cardiovascular risks by 20%. So yeah, the stakes are incredibly high, especially when you look at some of the more severe subtypes.
Okay, let's get into the symptoms then. Looking at the research, the anecdotes, it seems like 6 symptoms consistently rise to the top as the most common markers. We're not doing like a checklist thing here, are we? More like building a profile of the disease.
Precisely. Let's start with those physical signs, the direct results of that faulty scaffolding. The most pervasive issue, and really a defining characteristic for thousands, is joint pain. And this isn't just minor stiffness, we're talking chronic, deep, widespread pain. It affects about 80% of patients, often described as achy, debilitating.
And right alongside that, you have probably the most publicly known sign, hypermobility.
That's the classic one, yes. Because the ligaments and tendons holding joints together, they're mostly collagen. So faulty connective tissue means joints are overly flexible. That's the hallmark of the hypermobile type, HEDS. 60% of patients experience this. It leads to frequent subluxations, partial dislocations, or even full dislocations, sometimes from something as simple as sleeping wrong.
Wow. Okay, so then you have these secondary kind of systemic effects that just make daily life really complicated. Chronic fatigue seems like a huge piece of this puzzle.
It is huge and often really misunderstood. This chronic fatigue hits about 70% of patients, and it's not just feeling tired. It's a profound exhaustion that doesn't get better with rest. It seems often tied to the body just constantly working harder to maintain stability, maybe fighting systemic inflammation too.
Right. Okay, moving to the skin signs, the dermatological stuff. We see skin issues listed prominently.
Here, that faulty collagen makes the skin fragile, sometimes overly soft or stretchy, elastic. This shows up in about 50% of the EDS population, and it often comes with easy bruising, sometimes bruising that seems to happen almost spontaneously without significant trauma.
What's really striking is how this core connective tissue problem shows up in systems that seem totally unrelated, like the gut. Gastrointestinal problems are listed as key, too.
Absolutely. The GI tract is lined with connective tissue, so when that tissue is unstable, motility problems are really common. Chronic issues like IBS symptoms, persistent bloating, maybe stomach pain, these affect around 40% of cases.
And finally, the one that sounds the most concerning, especially relating to life-threatening risks, cardiovascular issues.
Yeah, this includes things like heart valve prolapse or, more critically, vessel fragility. Because the walls of our arteries rely heavily on collagen for structure and elasticity, Well, compromised tissue can lead to some serious risks. This affects maybe 20% of the general EDS population, but its prevalence and severity, they really skyrocket in certain subtypes, which we should probably talk about.
Okay, so that covers the main 6 markers. But our source material also highlighted 2 critical symptoms that are apparently highly prevalent, but often get missed in those initial screens.
Yes, exactly. The list tends to focus heavily on the more visible things or the mobility symptoms. The first critical omission, I'd say, is the broader category of chronic pain. While joint pain was covered, chronic pain, including nerve pain, widespread soft tissue pain, it affects a startling 90% of cases.
90%, wow.
It's the single most common symptom. It really underscores how widespread the systemic issue is.
And the second major miss.
Easy scarring. This is a direct measure of poor wound healing, again related to fragile collagen. You see it in about 30% of cases. It often presents as thin, widened scars, sometimes called cigarette paper scars, where the tissue just hasn't knitted back together properly, robustly.
Okay. And finally, let's touch on differential diagnosis. The butterfly rash. That often gets thrown around with complex connective tissue diseases, but you're saying that's a classic misdirection here.
It absolutely is. The butterfly rash or malar rash, that's characteristic of lupus. Seeing it potentially listed alongside EDS symptoms just shows precisely why misdiagnosis is so rampant. The systemic inflammation and pain in EDS can really mimic conditions like lupus or rheumatoid arthritis.
Right, makes sense.
Which brings us to why diagnosis is such a nightmare. It's this huge symptom overlap combined with just the sheer variability of EDS itself. We mentioned 60% get misdiagnosed. A big part of that is symptoms that wax and wane. Around half of patients experience these significant symptom flares, periods where things get much worse.
And the demographics seem to complicate it even more, don't they? Women make up 70% of cases, apparently. And they often face these unique challenges in, well, just having their pain taken seriously or having their signs dismissed as hormonal or stress-related.
Exactly right. It really speaks to a broader, maybe cultural component of chronic illness recognition. You mentioned that 2024 X post that got, 12,000 likes? The one that said, "Thought my pain was normal, EDS explained it all."
Yeah.
That sentiment is so common. The pain gets normalized over years, decades sometimes, until that definitive diagnosis finally provides the context, the explanation.
So understanding the specific types must be critical then, because that's where the risks really diverge dramatically.
Yeah,
Can you maybe outline the 3 main types people talk about?
certainly. The most common is hypermobile EDS, or HEDS. That accounts for maybe 50% of all cases. This is primarily defined by that joint hypermobility and the chronic fatigue we discussed. It's often the hardest to pin down diagnostically because, well, there isn't a single genetic test for it yet. It's diagnosed based on clinical criteria.
Okay, no single gene test for the most common one? That's tough.
It is. Next up is classical EDS, or CEDS, affecting perhaps 30%. This type is usually traceable to a specific mutation, often in type V collagen genes. The defining characteristics here are those really pronounced skin manifestations, the extreme skin stretchiness, the specific type of abnormal scarring we mentioned.
And the one that carries the most urgency, the one we really need to be aware of.
That would be vascular EDS, or VEDS. It affects maybe 5% of cases, so it's rarer, but much higher risk. It's characterized by a defect in type 3 collagen. Now, this is the life-threatening type because type 3 collagen is absolutely crucial for the walls of hollow organs like the intestines or uterus and major arteries. Faulty type 3 collagen leads directly to vessel and organ fragility, putting patients at a high risk for spontaneous, sudden rupture.
Wow, okay. When you lay out the types like that, the consequences of a delayed diagnosis become, well, terrifyingly clear. If EDS is left unmanaged, the sources suggest 40% of patients face organ complications. What are the specific risks of waiting years for that diagnosis?
Well, the body is essentially breaking down without the right support or management strategies. Chronic dislocations, sometimes happening daily, affect about 50% of patients. But focusing on VEDS again, about 25% of those patients experience a sudden life-threatening organ or vessel rupture. And sadly, about 15% of those events prove fatal. When you delay intervention, you significantly increase the likelihood of permanent joint destruction across types and those major cardiovascular events in susceptible types like VEDS.
So what does a timely diagnosis actually offer then? How much can intervention really change that trajectory?
It completely shifts the outlook. It moves from reactive crisis management, basically putting out fires, to proactive stability and prevention. We even have some financial data from 2024 showing that early diagnosis reduced hospital stays by 15%. That translated to about $500 million in healthcare savings. But honestly, the patient outcome is the real measure.
Right, the human impact. Tell us more about those non-financial gains. What does treatment look like?
Treatments are really focused on support. Things like specialized physical therapy, bracing for unstable joints, medications to manage the chronic pain, and sometimes autonomic dysfunction like POTS. These treatments, when started early, can control symptoms effectively in about 60% of cases within a year. Think about someone like the story of Sarah, 32. Her life was just defined by this invisible illness for years. Extreme fatigue, constant joint pain, terrible digestive issues. She was told over and over it was anxiety or stress. She lost jobs, lost her independence.
That sounds incredibly frustrating.
Terribly. It took her finally finding a rheumatologist who actually recognized the hypermobility criteria, who listened, to get the EDS diagnosis. And once she started tailored physical therapy, learning how to stabilize joints, not just stretch them, and got dietary guidance, she didn't just manage her symptoms. She basically regained control of her life narrative. That's the power of just knowing what you're actually fighting against.
That really highlights the impact, doesn't it?
Absolutely. And that kind of personal success story is what's fueling the current push for much broader awareness. Advocacy matters hugely here. Campaigns back in 2024, they reached something like 5 million people. And those efforts, they boosted physician screenings by 20%. Crucially, they managed to cut the overall misdiagnosis rate by 10%. That translates not just to millions saved in avoidable crisis care, but to potentially thousands of lives where years of suffering were simply avoided.
So if that momentum keeps building, what's the ultimate potential here for patients moving forward?
Well, raising public and, importantly, medical awareness could potentially prevent about 25% of major complications globally. If we just look at the potential economic impact in the U.S., preventing those complications could save an estimated maybe $2 billion by 2030. But we have to keep targeting the efforts towards those high-risk groups, primarily women, young adults maybe aged 15 to 30, where complications are actively developing, and of course, anyone with a known family history of unexplained chronic pain or hypermobility.
Okay. This whole journey into understanding EDS really reveals how fragile our internal systems can be, doesn't it? And how dramatically just one faulty protein collagen can derail a life. So our deep dive into the symptom profile, it confirmed those 6 major areas define the experience: joint pain, hypermobility, fatigue, skin issues, GI problems, and cardiovascular issues.
And I think the most critical takeaway for you, the listener, the learner, is to really recognize the vast variability of this condition and the very real dangers inherent in misdiagnosis. This is definitely an area where critical thinking needs to override assumptions, both for patients and clinicians.
Which really leads to an important question for you, the listener, to maybe mull over. Given that chronic pain affects 90% of EDS patients, and we know 60% are misdiagnosed, how many people out there currently diagnosed with general chronic pain, maybe chronic fatigue syndrome, or even fibromyalgia? How many might actually benefit from a deeper and more investigative look into their connective tissue health? A truly critical thought to end our discussion on today. Thank you so much for joining us for this deep dive into Ehlers Danlos Syndrome. That 2025 post really summed it up well. No EDS, support EDS. We hope this dive helped you achieve a bit of both. Please do leave a comment if you agree or disagree with our summary of these complex facts, and let us know your location. We're genuinely working hard to increase the reach of Mind Expansion Daily across the globe. And remember to like, subscribe, and visit Mind Expansion Daily for more great content like this. And yes, that link to buy us a coffee is right there in the description if you feel inclined to support our continued work. Next time, we'll be continuing this crucial conversation, looking into related fields.
Watch our next video on autoimmune disorders. We'll see you then.